Welcome to Board Certified, expert interview episodes about medical licensing exams and healthcare careers. I'm Tyler, the founder of Achievable, and we offer affordable adaptive online prep courses for the USMLE Step 1, MCAT, PTCE, and PTE, CSCS, and others. Each course contains everything you need to succeed, including comprehensive study guides, video lessons, thousands of practice questions powered by our memory enhancing algorithm, and full length practice exams. You can try any course out for free by going to achievable.me and be sure to use the code podcast to get 10% off. Now, let's get started. So, today we've got the PTCB exam tutor, Lorraine Lohner, with us.
Hi,
And Lorraine, I'd love if you could introduce
my name
yourself.
is Lorraine. Students call me either Professor L or Miss L. Yes, Tyler found me on my YouTube channel, PTCB Exam Tutor. I am a program director for the pharmacy technician program of Pima Medical Institute, and I'm a twice Amazon best-selling author for Top 200 Drugs Memorizing Made Ridiculously Easy and Pharmacy Calculations Made Ridiculously Easy. I also won the Master Teacher Award given by Elsevier and Best. So every day I teach this like it's part of my well-being and it runs in my blood teaching pharmacy day in, day out, and even on my days off. Because on my days off, I write the book.
That's great. Yeah, so I wanted to start out, with this episode, we're just going to cover all the basics, right? And so, let's talk about obviously what is the PTCE, right? Or sort of its cousin, the XCPT.
Okay, it is by the organization called Pharmacy Technician Certification Board. This is the OG National Certification Exam for pharmacy technicians, and the PTCB only certifies pharmacy technician. Let's talk about, like you said, its cousin, ExCPT. ExCPT stands for Examination for the Certification of Pharmacy Technicians, and this is by the NHA. Compared to PTCB, the NHA gives certification to not just pharmacy technicians, but other professions as well. As I have mentioned, it is a national certification exam that helps pharmacy technicians prove that they can work in a variety of settings, including retail, hospital, mail order, and other specialty pharmacies. So I think we're going to discuss the other things like why you need to be certified in the next questions. But just to answer your question about the PTCE, there are two. It's a national certification exam specifically for pharmacy technicians.
Yeah, great. And, the purpose behind the PTCE is at the end of the day, if you're giving people very often can be powerful or sometimes even addictive drugs, you got to know what you're doing and make sure that you're giving them the right thing in the right amount, taken the right way. It could kill someone if they took the wrong drug or took the drug too often or other things like that.
We're going to be discussing the contents, why it's important, and what are the topics that we need to study.
Yeah, and let's start with just why it's important, right?
Let's talk about the legal aspect first. There are states that require a pharmacy technician to be nationally certified in order to work in that state. So before I hopped in, I actually just checked. They can look this up, ptcb.org map. If they type that on the internet, they will find a map. But just so they know, the latest map is as of December 31st, 2024. They update this every year. And this map is color coded. It color coded the state. Each state can have a teal, it can have an avocado green color, or it can have it's three colors, an orange color. So the teal, I focused on the teal. The teal states are the ones that require that you be registered as a pharmacy technician in the state. And on top of that, that you be nationally certified. Let me name some states: Texas, New Mexico, Arizona, Utah, Colorado, Virginia, Louisiana, Kansas, Wyoming, South Dakota, North Dakota, Montana, Washington State, Oregon, Iowa, Illinois, some parts of New York, and Puerto Rico. So the ones I mentioned, you cannot work in that state without being nationally certified. So you have to register with the state's Board of Pharmacy plus pass a national certification. Whether it be a PTCE or ExCPT depends on the state as well. Like I said, PTCB is the OG, so back in the day it has to be PTCB. But now there are states that accept both. So that's the first one. The legal aspect. Can you work or can you not work as a pharmacy technician? The second one, for states like us, I'm from Nevada, I'm based here in Las Vegas. We are only requiring pharmacy technicians to be registered in the state of Nevada, Nevada Board of Pharmacy, State Board of Pharmacy. However, it is catch 22. Why is it catch 22? Because many employers require that a student or a graduate or somebody they're hiring be nationally certified, specifically PTCB certified. So I send my students to hospital. I'm the one negotiating and communicating with this pharmacy directors, asking them, inspecting the pharmacy if it's a good setting for our students to go on externship. And whenever a student finishes their, in our case, 240 hours of externship, when they like the student or they really think that they'd be a good fit at the hospital, the first thing they say is, before we give you the offer will stay, but you have to take the PTCE. So I always tell my students you can take the PTCE ahead of time, even before you finish, which we're going to talk about later. But I'm just talking about the advantages. So, legal aspects. Second one would be, yes, your state doesn't require it, but your employers do. I've heard from graduates, many graduates still are in touch with me. Even Walmart is requiring them to do the national certification within the first year of hire. Some Walgreens do that, some CVS do that, so it really depends on your employer. Since it's becoming catch 22, me encouraging my students become me forcing my students to take it. And so after class, we some PTCE reviews so that we could keep up with this. The PTCE or being certified, nationally certified, is not required in our state. However, leading to the next advantages, it opens more doors, more opportunities, better pay. There is an increase in pay, and greater respect and trust from colleagues and patients. You'll be surprised if you're part of some forums. There's even some sort of a discrimination between PTCB certified and NHA certified, but I'm not going to deal with that. It's because PTCB has been there a long time and NHA has had the certification, but they became more popular. They became a competitor in 2020 when the blueprint changed. So, because the requirements of PTCB became stricter, and so NHA came into play. But better pay, more job opportunities. It's a way of telling the employers, especially for states that don't required, hey, look, I'm only required to be licensed or registered at the state board, but look what I did. I'm willing to do more, and I'm nationally certified that I can work in any specialty. Because the PTCE, we're going to talk about its contents, actually shows that you can actually be more multi specialty.
Yeah, I mean, I have heard that talking to other people, and I know you don't want to get too far into this. This will be my one question on it, but I've heard that sort of the NHA's XCPT is really focused a lot more on like retail pharmacies, like your Walgreens, versus the PTCB kind of covers everything.
I wanted to prove myself how this is really going. Okay, so I'm part of forums of both pharmacist and pharmacy technician, and I don't want to use the word discrimination, but that's what's going on in that forum. Some technicians who are PTCB certified would be like snotty and say, I'm PTCB, not NHA. And so I said, what is this going on? I got curious myself. What is this going on? To me, I'm pro certification. That's it. but I do understand where it's coming from. So to answer your question, I took the PTCE in 2018. That's why I can talk about it, because there's a 2 year or 3 year where you couldn't talk about it, shouldn't talk about it. I just had one student who came here today. He just passed. So I'll talk about the content later on. But we're not going to divulge names. And we're going to talk about patterns too, because 17 years doing this, I've seen the patterns. I know how it goes. So, yes, when I took the PTCE and continuously my students are taking it, they come back and tell me it is really almost everything, every setting, from retail to hospital, a lot of hospital questions. And I'll tell you how it shows up content wise. A lot of hospital questions. There are compounding questions, both sterile and non sterile compounding. And so there are specialty questions as well. There's immunization questions. On the PTCE, we'll talk about the math part too. On the ExCPT, when I took it, that was pandemic. I wanted to try a different setting too. So I tried PTCB in a testing center, and I tried ExCPT at home. So I can tell my students, don't go to the testing center or don't go. My bottom line there is don't take it at home. So going back, for the ExCPT, yes, it's mostly retail. And I joke about this. I tell my students on your second, we call it sequence instead of modules. On your second sequence, you can take the ExCPT if you just want the title, because just that far, we're an advanced accredited program. So we do sterile compounding, non sterile compounding. We're the only school that has IV certification in the entire state. And so I told them if you just want the title, you can take it on your second sequence. But it became a challenge. So I had students taking the PTCE on their fourth, third, second sequence. It's mostly retail. Even the math for the calculations part is retail for the ExCPT. But for the PTCE, you'll see allegation questions,
Yeah.
dilution questions, a lot of percentages, a lot of more specialty setting calculations. For the PTCE as well, there's a lot of questions on medications, which we're going to talk about. They highlight so much on patient safety, drug to drug interaction, drug to food interaction, drug to disease interaction, which you'd think that's a pharmacist question. But because of the advancing roles of pharmacy technicians, being MTMs, medrecs, and all specialties, they want to make sure that you know these things, because this is the initial stage, being PTCB certified with the title CPHT. This is the initial stage to doing their advanced certification, MTM, medrec, diversion, controlled substances diversion. So that's a comparison.
Yeah. Great. Yeah, and I mean, I think that segues really nicely into talking about
Leading
the
into
contents of the test,
the needs.
right? Like I think you already named a bunch of them. But, yeah, yeah, I think it's a good time to kind of start getting into that. And I mean, the big buckets are medications is 40%, patient safety and quality assurance is 26%, order entry is 21%, and federal requirements is 12.5%. There's some quarter percentages in there that make it all add up. But, I think obviously, we're going to do a deep dive on medications next episode, but I think it'd be good to start obviously with medications as that's the biggest thing. Just tell me a bit about, I mean, obviously there's at least the top 200 drugs because you made a book about it.
Okay. The book is a response to the blueprint change in 2020. Okay. So back in the day, the national average or pass rate is only 58%. And even during that time, we have a 100% pass rate on first try. So we were expecting in 2020, when the blueprint changed, there'll be more fails. And so I looked at the blueprint and I saw that medications is 40%, federal, and then patient safety and quality assurance is 26.25%. Those two major ones, that's medications. It's saying medications is 40%. And my students who are recently taking the test, the first thing they say is a lot of medications. So I titled my book Top 200 Drugs Memorizing Made Ridiculously Easy. The memorizing part is clickbait. I have to be honest with you. But my students know that I hate the word memorize. They know that. Because if you memorize, what happens is you're going to forget it after the test. When you trip, you're going to forget it. When you were communicating with too many people before a test, then you're going to forget it. But if you understand, it's long term. You know what the drug does, you know how it affects your body, you know the side effects, you know that if you take this drug, and another drug, this will happen. You know that if you take it with grapefruit juice, this will happen. You know that if you take it with broccoli, this would happen. And that's how the PTCE now is worded, or their questioning goes to that. It's more patient safety related because something's going to happen to the patient if you take this drug with this drug, or your patient is taking grapefruit every day not knowing that it will affect one of their maintenance medications. And so, like I said, the book that I wrote is in response to how do you really study, which is, like you said, our next topic later on. This top 200 drugs, do you memorize them all? What's important? Brand, generic, class. That was in the old days. You have to remember the brand, the generic, the class, group them by class. But nowadays, my student just came here, like I said a few minutes ago, or while the class is on, and we asked him what showed up. A lot of drug interactions, a lot of drug to food interactions, a lot of drug to disease interaction. So I knew that was happening because I took the blueprint seriously. So in my book, I put tables of drug to food, drug to disease interactions. And the way I do medications or the pharmacology classes, I like telling stories. You can shut down my PowerPoint and I'll roll still. Okay. Why? Because if I explain, I draw, I call it my ugly drawings. Funny sticks in the head, ugly sticks in the head, and the students love that. And so I say, okay, forgive me, because when God showered the artistic ability of drawing, I was sleeping or hungover, either one of those. But anyway, my drawings are ugly, but they remember and they replicate the ugly drawings when I talk pharmacology. The sympathetic, the parasympathetic, the drug to drug interaction, what happens, the drug to food, they'll remember all those things. Funny sticks in the head, patterns, pattern interrupt. And so all of those, the tips I also talked about in the book. And so, like I said, that was a response to the book. Lots of medication. Every single student, just this month alone, I have 5 students take it, all passed on first try. So we still have the 100% pass rate on the PTCE on first try. And every single one came back and said, lots of drugs, not just brand generic class, therapeutic duplication. And this back in the day would be a pharmacist question.
Yeah, I mean, I think that that is kind of just an overall trend. Is I think that pharmacy technicians are getting
Yes,
more
because there's a
involved,
lot
and
of
pharmacists are almost
specialty.
becoming like managers a little bit. That's the topic for a whole another podcast. But yeah, well, great. Yeah, I think that covers the first two pretty well.
I want to highlight that patient safety and quality assurance means drugs as well. And on top of that, it means calculation because we may damage somebody or make somebody unalive, as they say now, if we give them the wrong medications. And I always say, overdose is, yeah, we don't want to
You
hear
don't
that
want to
from my
unalive
student.
anybody.
But anyway, I don't know how strict you are with our wordings, but my students know that if you give somebody overdose, an over calculation of, we actually have babies each one, and I say take care of the baby, I'll take away the baby from you if you do your calculation wrong. So it helps them become more conscientious. Somebody gave us babies, one of our students. Anyway, so the patient safety part not only covers medications but also the calculation part, I believe so, because of, if you calculate a drug wrong or the amount of drug that you inject either directly or take the patient directly by mouth or inject into the IV bag, what's going to happen to the patient, right? And I always say underdose is just as bad as overdose because that's how we create superbugs, the underdosing of antibiotics. And so I say not only do we focus on drugs since it's major, we also focus on the calculations part. And if They're paying attention to the blueprint. At the bottom, there's an asterisk that says some or all of this statement reflects calculation based knowledge. And so this is my response to that as well, which is pharmacy calculations made ridiculously easy. But it's not really specific to PTCE. It's both, but it covered all specialties, including the calculations, allegations, flow rate, and drip rate. Because of that fine print at the bottom, every single query will have some, or knowledge domain will have some calculations in it. But personally, I really think that the calculations fall greatly on the patient safety and quality assurance, including the medications, calculations of the medications. So those are major. I did have one student last month who passed the PTCE, and she said, I did get a lot of law questions. She said 5 math questions, but more law. And this is my explanation to that. The PTCE or the PTCB has a question bank, tens of thousands. And we don't know what's going to be delivered at that time. They'll pull 90 questions and deliver it to you. So, how much is what? We don't know. It's like a lottery. So, some students get more
Yeah.
math, some students get less math. But the bottom line is be prepared. And so, in response to my students saying there's a lot of federal laws, I'm on my days off, I'm actually writing a
Mhm.
storybook on federal law.
Yeah, well, and also, like you said, I mean, not every exam will be exactly the weightings that they say they
Right.
will be, or there'll be differences within the questions. It might still be a medications question, but it'll be different than ones you maybe see in a different
Yeah, to
test.
me,
So you just gotta kind of widely prepare.
one would be pharmacology if they're in school or they're in a training program. One would be pharmacology that covers your medications. And then pharmacy calculations or pharmacy math or med math, whatever they call it. Okay. And then law, pharmacy law or federal law. And then the last one for me would be compounding, both sterile and non sterile. So my program focuses on those 4 major topics, my online review program, because of the pattern I've seen throughout 17 years. I've been doing this, I've been teaching the program.
Right. Yeah, that's great. And I mean, let's talk now about the just sort of the logistics, right? So, first is, let's talk about preparing for the test. When should you start? Or when do people typically start? And then usually I know that the PTCB like has a 500-hour work requirement that goes alongside you passing the test in order to get certified, right? So kind of how are people typically taking this while they're in some
Oh,
kind of
yeah.
like master's or program or finishing school like you
Okay,
just
cool.
mentioned, or are they typically taking it while they're working at a job already?
According to PTCB's website, how you could be qualified to take the PTCE. The first route would be going to an accredited program, training program that can be a vocational school like Pima Medical Institute. That can be my online training program, which is CPHD in 90.org because we're PTCB recognized. That can be an ASHP ACPE accredited program like Pima as well, and CVS, Walgreens, Walmart. The major chains are ASHP accredited. So that's one route, a formal training or education program. The second route is what you said, which is 500 hours. Your pharmacist has to sign you off that you did 500 hours of on the job training before you're allowed to sit for the PTCE. If you're still in school and you're registered under a tech in training, you have to finish the program because you have to present a certificate to the PTCB that you finished a training program. But what you can do while you're doing that training program, you can already take the test. Some of my students did that on their third, fourth, second sequence. But what happens is if you sit for the PTCE and you pass, but you're not yet done with your training program, PTCB will hold off on releasing your certificate until you submit to them your certificate of completion and then they release your certificate, your PTCB certification. Okay. And for the other route, 500 hours, your pharmacist will sign a waiver or proof that you did 500 hours on the job training. And then that will be what's submitted to the PTCB. And then you get
Mhm.
your certificate. If you're in a training program, do not wait. You don't have to wait unless you really feel that you really need to study more or the coming modules or sequences is necessary for you. Like I said, it became a challenge for my students. Why? Some took it on their fourth sequence, some took it after externship, and then the ones who took it after externship, they're just waiting. Our state releases license 2 months. That's how much delayed it is. So the offer, I don't know if your employer is going to wait 2 months for you, right? So I said, how do we kind of work around this? And the way to work around this, take the
Mhm.
test before you go out on it, which nobody's stopping you from doing, not even PTCB. So some took it on their fourth or third, their second sequence, and they pass. So those ones who are only halfway the sequence, of course, I support them on the side because there are major classes that they haven't taken. I give them references and I coach them on the side. Do you really want to do this? Or I'll stop them from taking it. I'll say, you know what? Law is coming up. You wait until law is done. Okay. And then because I test them all the time and I'm their primary instructor and program director, I also teach,
Mhm.
even if I'm the program director, I teach the major classes: pharmacology, pharmacy calculations, pharmacy law. I have a good feel of the student, whether they're ready or not. Sometimes I have to tell the students, you got to wait until you finish it before you take it. But here's one good advice that my three of my students told me. It is really good to take it if you're in a formal program, training program, halfway your externship. Why? Yeah, you learned a lot from your training program, but you learn a lot more while you're on externship. And halfway would be enough. You pull drugs, be it retail. Because we're an advanced accredited program, we're required two settings, two rotations. And so one would be retail, one would be a hospital, one would be retail, one would be an IV infusion. So there'd be
Mhm.
two settings. But if you at least get out, do the job of a pharmacy technician, the real deal, even if it's just externship, you have a pretty much better gauge and additional knowledge before you take the PTC. And I thought that was a great suggestion. So I advocate for that. Self study now. So if we're talking about self study, um, there are training programs or review programs. I do have a review program outside, which is cphtin90.org, and there are others as well where you could take it. Though the CPHT90 program is recognized by the PTCB. So we have a partnership, which means the certificate that you're going to get from the CPHT in 90 is an acceptable certificate by the PTCB. Of course, there are others who do that online review program, that kind. The difference is we don't have externship. And for us, it's straightforward. It's a review program, and we're telling you it's a review and training program, more than enough to pass your board exam. That training program that I have outside of my program here is 100% pass rate as well. That was an answer to people outside of Las Vegas because I got so many emails from different states, different students telling me, are you going to come up? It started as a challenge, and then now it became an online review program. And so a lot of emails or DMs I get, I wish I found you sooner. I failed twice already. So this is an answer to those who are having a hard time passing. There is a second chance, there is a third chance. Sometimes I get a third timer, and it feels so good to help that student pass the PTCE. They can take it anytime. The only requirement is either
Mhm.
one of these two must have gone to an accredited or education program, or the 500 hours plus a a waiver, not really a waiver, but an attestation from a pharmacist, a licensed pharmacist, that they did this hours. Then they can sit for the PTCB.
Great. And it's also just like something that hopefully you'll be getting support from either your manager or like other peers that have gone through the process as you're doing it. So you can continue to kind of ask questions as you're going along. And I think
Yeah.
also just like in general, the key is just to be consistent, right?
Yeah.
So what shouldn't you
Yeah,
do?
but I want certain things like don't do this. Okay. Things that you should not do or common mistakes. I'll talk about that. Cramming, number one. I'm not a crammer. One of my best friends is a crammer. Back in pharmacy school, she'll just grab my notes 10 minutes before the test and she's fine. But I'm not a crammer and I don't advocate cramming. I really think that if she wasn't a crammer, she would have gotten higher scores, but she's happy with passing. So, cramming, no, no, especially with at least 200 drug words, drug names, do not do it, okay? Confusing, similar sounding drugs. You have to find ways, which we're going to talk about later, on how to remember this ones. I'm a big fan of educated guesses, and I'll teach them later in the next episode how to make educated guesses and choose the right answer on a test. So, confusing yourself. There are ways to do that, there are tools to do that. Another no no or big mistake is studying passively, just regularly highlighting, not focus. I'm okay with 30 minutes or 1 hour focused studying, okay? Instead of like just so you could say, I studied today, but did you retain the information? Right? Just to do that 1 hour you said you're going to do every day. It's nice to have us, and they
Mhm.
should follow that schedule. Set a time, a place, a specific spot where they study. But I'm a big fan of what you said, consistency. It doesn't matter if that's 15 minutes, 30 minutes a day, and if they're working their flashcards on their break, it's real easy. I have audio lectures. My students listen to them on their drive to work, on their drive to school. So if you have those, because I believe that you don't have to see me to learn pharmacology, so my lessons in pharmacology are in audio. You just have to listen to me and there'll be retention. But for math, you have to see me do how it's solved. So it's videos for math. For law, you don't have to see me too. Just listen. But if you're driving, if for me, it's a 40-minute drive one way to get to the campus. I love podcasts. I love audiobooks. And I have students who drive an hour to get to school. And so I tell them don't waste that time. Funny funny thing, one of my students said, I was listening to your audio lectures before bed trying to remember the drugs, and when I woke up I thought you were in my room because it was still playing. But that was, I said, kind of creepy, but I said you do what you gotta do, you know? Because retention, you hear me, you don't have to see me when I talk about these drugs, but they listen to this pharmacology stories like, I had this patient before, this is what happened, and then they remember the side effects. So if you make it like storytelling, like, it's long term, it sticks in the head. And so find something funny, writing on the book, writing on, having a notebook, just that consistency, cards, 15 minutes every time you get a break, every time you get a chance. Almost all my students work. And so I have a morning and a night class. So the night works in the daytime, the morning works in the afternoon after here. But the really responsible ones, diligent ones, and really are serious at doing this, you'll see them on their break time, either on their phone. It's very hard now to tell compared to back in the day. Don't be on your phones. So now there's tools on the phone. I even created my own mobile app. And it's because, again, an answer to another student, I wish I could carry you in my pocket with me so that I could take you anywhere with me. And now I was thinking, if you can't beat them, join them. But of course, on certain parts of the lecture, when I'm really lecturing and there's no need for a phone, I want them to put away their phones. But this is the generation where you have an app for everything. a tool for everything, an AI for everything, and it's right there at their fingertips. I said, I wish I was studying during this time. It would be so much easier.
Yeah, well, and I think it's important to use the tools that you've got, and also at the end of the
Yes.
day, you got to put in the work. I mean, we have had a bunch of courses for a bunch of different topics, and it turns out that there's a pretty good correlation between the amount of
I've been
studying that you
preaching
do
about
and
that.
how good your score is at the end, right?
One of focused work, yeah. We do have students sitting in the classroom. They think just showing up in class is enough, not doing the homework, not doing the studying, not doing everything. I said it has to be both showing up and doing the work. Both.
Yeah. Well, great. And I feel like that is just, we've covered almost everything I want to talk about today, but I wanted to kind of ask you one last question here, which is for the people that are listening and they're just looking to start the journey towards becoming a pharmacy technician or taking the
Okay.
PTCB, what advice do you have for
Like you
them?
said, study. That's big. Nobody took the PTCE just, even if they're pharmacy technicians already, who just walked in and said, I'm going to wing it. There's no such thing. When I took it, I'm a pharmacist. I still browsed a book, a PTCE review book. I finished it cover to cover, and I'm a pharmacist. I finished it cover to cover before I said, I'm going to take it. Because I wanted to show that, you know what? The practice that you have, you don't pull those drugs all the time, especially if you're in a specialty setting. In a hospital, you pull the same drugs. In a specialty setting where you make, say, HRT, you pull just HRT. In retail, you may be able to pull a lot more. So even seasoned pharmacy techs or pharmacists should still review or study not only the content, but the format. Having a practice bank, a practice test helps before because of the format and preparing you or a simulation of the test helps you a lot. So I paid for a practice test as well before I took the PTCE because I want to simulate. I want to see what's ahead of me. And when you're prepared, there's less to no anxiety. I always say this. Anxiety happens when you're not prepared. Yeah, it's normal to get nervous every now and then. And I always tell this to my students, being anxious is the same as being excited. It's the same feeling. It's a matter of how you want to look at it. Are you excited to take the test or are you anxious to take the test? I'd rather go with I'm excited to take the test. It's the same feeling. It's coming from the same place, but you're only going to have that feeling of excitement if you know that you prepared for the test. There'll be a lot of tools available to them. Another advice would be do not overwhelm yourself by getting so many tools. You're going to get overwhelmed. So stick to one or two. Stick to one or two, and they're more than enough. Because there's not going to be, you got everything. One or two would be more than enough. The one that speaks to you, even just one review book is enough. That any review book that covers all of this knowledge domains in the blueprint and have good reviews on Amazon if they want to get it on Amazon. Read the reviews, why they're useful. I always tell the students don't spend too much. Like, oh, but I still want this before I take the test, and I still want this before I take the test. No, stop that. Use what you have. So prepare and do not overdo the tools or the references. One, stick to one or two. You should be good to go, but truly prepare.
Yeah, that's great. Well, thank you so much. This has been Board Certified, hosted by Tyler and Cassandra from Achievable, with Lorraine Lohner from PTCB Exam Tutor on YouTube. And Achievable has great online courses for the USMLE Step 1, MCAT, PTCE, NPT, CSCS, and others. You can try them out for free by going to achievable.me.